I'd like to start by acknowledging that the lands on which we're hosting this meeting include the traditional territories of many nations. The work of Medify and our partners takes place on traditional territories of the Indigenous nations who have lived on these lands since time immemorial. Medify is located in Toronto, on the ancestral homelands of the Huron-Wendat, the Anishinaabeg, the Mississaugas of the Credit, the Haudenosaunee, and the Attawandarons. This is Dish with One Spoon Treaty Territory. Medify is committed to reconciliation. We recognize that the many injustices experienced by the Indigenous peoples of what we now call Canada continue to affect their health and well-being. We respect and embrace the rich cultural and traditional practices of the ancestors. We invite our partners to reflect on the territories where they are situated and to join us in committing to gaining knowledge, forging a new culturally safe relationship, and contributing to reconciliation. And that acknowledgement feels especially important tonight with our guests. So the goals of our monthly webinar series, I think we've chatted about before. We hope that this series helps to build and foster interdisciplinary, integrated, and innovative models of care, and our network, our community of practice that's spread really across the province and across many different types of practice. We are so pleased tonight to welcome our three presenters, Pia Heikkinen, Denise Forsyth, and Allison Crewe, who are talking about the Northwest Ontario RAAM Toolkit. And our objectives are that everyone attending this webinar will be able to describe the collaborative approach taken to the development of this toolkit in Northwestern Ontario, recognizing that it serves a vast geographical region with dispersed populations and limited resources, that our participants will be able to articulate Kenora's framework of a community approach to a mobile model of care and cultural safety, and discuss the hub and spoke model of care for RAAM clinics in Northwestern Ontario. Again, please share your comments and questions during the webinar. If there's something that feels like it's time sensitive, I will pose that question. Otherwise, we'll be saving the last 30 minutes for discussion. So I'll be accumulating the questions as we go. The evaluation will be circulated. Please complete that so that we've got your feedback. Oh, I was supposed to do my introductions. I'm so sorry. Pia Heikkinen is the Northwestern Ontario Regional RAAM Coordinator. She has 23 plus years working in addiction and mental health for St. Joseph's Care Group in Thunder Bay. Her variety of work experience ranges from creating and managing intervention and prevention programs to leadership in intensive residential addiction programs. Most recently, Pia has taken on the role as the lead for 8 Northwestern Ontario RAAM clinic sites, helping support, coordinate, and guide them in the creation and expansion of a hub and spoke model of care in the region. When Pia is not immersed in addiction care, she's an avid cross-country skier and enjoys spending time with her 2 rescue dogs in the great outdoors. Denise Forsyth is a social worker who resides in Northwestern Ontario. She's worked for 35 years in the area of mental health and addictions. Her current role is that of Senior Director of Mental Health and Addiction Programs at Lake of the Woods District Hospital in Kenora. In 2021, she was awarded the Jane Chamberlain Award for her outstanding contribution to mental health in Ontario General Hospitals. And Allison is a nurse who's been working in the field since 2011. She started her nursing career at Sioux Lookout in maternal and newborn health, and has been working in the area of addictions. She was one of the first to introduce buprenorphine into northern remote communities. She began nursing in Kenora with a mobile outreach RAAM, and as a nurse practitioner in 2021 with the RAAM. I hope I'm getting that right, Allison. Please correct me if I'm wrong. And she is the mom of 3 tiny humans for whom it's dinner time right now. So we are so grateful to all 3 of you for joining us. And we're really looking forward to your presentation.
Thank you, Jennifer.
Thank you so much, Jennifer, and welcome everybody. Nice to have everybody here. I'm going to get started with my presentation, and we'll move through that, and then we'll have Denise and Ali present theirs, and then we'll take some questions at the end. Feel free to put your questions in chat as well. But I'm really happy to be here, and I'm just going to share my screen here to get us started. Oops. Okay, so thank you everybody for joining us for Standing Strong Together, Mash Kawiga Bawida, a toolkit for the Northwestern Ontario RAAM approach. I just want to disclose that we have no relationships with financial sponsors and no sponsorship funds have been received. We will be receiving a speaker honorarium tonight for tonight's presentation. There are no conflicts of interest to report. Our objectives this evening are to describe the collaborative approach. I think we went through this. I think Jennifer went through this, so I'll just move on from that. So I want to just start by giving you a bit of background on how this initiative came to be, what we have accomplished, and where we are heading. I'm located in Thunder Bay, and I just want to give you a little bit of a background on what we have in Thunder Bay. So we've got 2 clinics, actually officially 3. One kind of closed down in our withdrawal management area during the pandemic, but we're slowly starting to reignite that, recognizing that our withdrawal management in Thunder Bay is at capacity and there's not enough kind of space for a RAAM clinic, but looking at moving into kind of a virtual model, and I'll talk a little bit more about that. But we have 2 sites here in Thunder Bay, one at Northwest Community Health Center and one at Delico Anishinaabe Family Care Family Health Team on our first William First Nations. We have multiple partners in our RAAM clinics. So I want to just kind of give you an idea of what that looks like. So our 2 sites are at Northwest and Delico, like I pointed out. And so Thunder Bay Counseling is a partner, and they provide counseling services for our RAAM clinic times. Delico also provides counseling and nursing support. St. Joseph's Care Group, who I work for, provides counseling and physician support, as well as funding the coordinator who works out of Northwest Health Centers. So we have mostly RAAM funded positions, but we also provide a lot of in-kind supports from our partners. And our teams meet monthly, and the local Thunder Bay Advisory Committee meets quarterly. And then I'll move into talking about the Northwestern Ontario approach as well. But just wanted to get the sense of the partnerships that we have for our RAAM clinics in Thunder Bay, and we all really work closely together. Our governing body is Medify, and we adhere to these standards and guidelines, and we look for Medify for best practices. And we've also developed relationships with community partners as well that facilitate evidence-based care, developing low barrier access to addiction care in our community. So the vision for Thunder Bay, Northwestern Ontario, is to promote holistic, client-centered service that is really founded on strong evidence and sound practices, which is really embedded in cultural safety and an equality and equity lens. So how we do that? Well, we do have an interdisciplinary care team, and that's one of the ways that we kind of reach our goals. Our team really draws on the expertise of people with lived experience, who we call our peer support folks. Counselors, medical providers, administrative professionals, and we really provide a wraparound service. So all our teams play a really integral role in helping support the clients that walk through our door. The team in Thunder Bay meets twice daily, pre and post clinics, to share information, brainstorm next steps, and figure out strategies for our clients. So that's just a really brief overview of Thunder Bay RAAM. I think most folks are familiar with RAAM clinics, but I really want to talk about the Northwestern Ontario region and how that kind of came about, the collaboration that came about there. So it started in 2021 in partnership with Northwest Community Health Centers, which is the site that one of our RAAM clinics is located at. We were the lead, St. Joseph's Care Group, in partnership. And we secured funding through the Public Health Agency of Canada for this project. So the goal of this funding was to engage with funded RAAM agencies and key stakeholders to capture current information regarding the various RAAM models of care and to examine priority needs regarding access to addiction medicine across Northwestern Ontario. So the funding was very specific in the communities that they named to be a part of that project. And so if you can see here, Thunder Bay's kind of located in the middle, and to the east, we kind of have Nippigan, Marathon, and Long Lac, and to our west, we have Dryden, Fort Frances, and Kenora. So we really understood that in Thunder Bay, we were not the experts, but the folks in the communities that we worked with were. So we formed an advisory committee to help us move forward in this project. And the goal was really to take a collaborative approach and share innovative ideas, gather information, identify emerging trends, issues, like really looking at strengths and gaps and needs to really enhance RAAM services across the region. So an advisory committee was formed, and it included 8 sites, 30 plus members in that committee with 25 plus partner agencies. Because not only Thunder Bay works in partnership with multiple partners, but all our sites in Northwestern Ontario do. It really helps support the work that we're doing with limited resources. So I just want to give you a perspective of Northwestern Ontario. So this is the bigger map of Canada, obviously, and we're circled here in Ontario, and we're deemed remote with very remote access in our communities, and we're very, very spread out. So geographical distance has always proven difficult to navigate for clients needing services. And we know that many communities in Northwestern Ontario, have limited healthcare services. In addition, the Northwest has a really high percentage of people who identify as Indigenous, actually 24.8%. As compared to Ontario's overall of 2.8%. So we have a high population of Indigenous folks in our area. Just to give you a really good idea, this is our geographical reach. We have one of the largest service areas in Ontario. It takes about 12.5 hours to drive from the Manitoba border, which is close to Kenora, where Denise and Ali are from, to Wawa, which is the furthest end of our service area. So it's a really large service area comparable to some of our other Ontario health boundaries that are much smaller. Just to give you an idea, it takes about 12 hours and 21 minutes to drive from one end to the other. So a really important piece of this work, understanding that we have a high Indigenous population, was really working alongside our Indigenous partners. Just to provide that safety and well-being, we definitely engaged and collaborated with our partners, including those who are First Nations, Inuit, and Métis. And we work really closely alongside Delico Anishinaabe Family Care, who is another site partner of our RAAM clinic in Thunder Bay. And Delico promotes healing and well-being of the Anishinaabe people using a really integrated holistic approach in a way that honors values, cultural and traditions. And they also had representation along the way on the committee. And we also, I held an engagement session in the surrounding areas of our First Nations and Indigenous people to really communicate about the work the 7 communities had started and to really encourage joint collaboration and planning kind of moving forward. So during this process, along with the advisory, one of the objectives and an outcome was to create a toolkit that I'm going to talk a little bit about, and hopefully you have seen. And the purpose of that was to serve as a guideline to help those who provide service to individuals who use substances to be able to adopt the Northwestern Ontario RAAM approach in care in unique workplaces and contexts while providing best practices. We wanted this document to be really comprehensive and reflect the approach taken in the region. And we realized that this wasn't a small feat as there were so many moving pieces in our work. So we formed subcommittees to take on a more focused approach in regards to disciplines and how we work together with the key principles of client-centered approach. So this is kind of a visual of like our partnerships, our safety, and like the client's always in the center. And this is the kind of team that supports them. So out of that, the Standing Strong Together Mashkawiga Bawida toolkit came to life. This toolkit really gives practical tools for all levels of service provision to expedite service planning and early response for folks who are interested in any community interested in establishing a RAAM clinic. And it was really developed to suit a vast geographical region with dispersed populations. So Mashka Kawida translates into Standing Strong Together. It's from the Southern Treaty 3, Lac La Croix dialect, which is maybe it's a little different from other First Nations in the region. But we had an advisory member who took it back to her community, and ceremony was taking place, and the name was given for us from an elder to use in this context to help folks that use substances. So it was really a nice gift to us to be able to use that name. It was very, very powerful because we felt that that's what we do. We stand strong together and we work really collaboratively together to help our clients. So we're really, as a collaborative, we're really committed to implementing these strategies that are in the toolkit, including like policy and procedure, and they're all influenced by Medify guidelines. And we really want to standardize care across our partnerships. And this toolkit has been shared far and wide across the region, the province, and actually the country, and it can be found on eNet Connect and on Addictions and Mental Health Ontario websites, and I'm happy to share the link as well. I'm just going to stop my PowerPoint for a minute and pull up the toolkit. I'm going to stop my share for a minute, and I'm going to pull up the toolkit so I can kind of walk you through just a little bit of it, give you an example of how it's used. So it's here. Okay. So here is the toolkit, and it's really nicely laid out. It's super interactive. It's quite lengthy. I'm not going to go through the whole thing. I know folks can look at it at their own leisure. And so it starts here, and then it's got a beautiful table of contents that really kind of breaks down the vision of the Northwestern Ontario approach. And it's really easy depending on what you'd like to look at. It's really easy. You can click on these wonderful highlighted areas and quickly get down to those areas. So for instance, my favorite example is like if you're going to look at the essential elements, you're going to click right down there. It's going to talk about administration, medical, counseling, and peer support. So if you wanted some medical information, you just click on there. You can make it a little bit bigger. And then depending on what you want in your medical, from your medical model, all the headings are here. So if you wanted to look at policy and procedure, it takes you down to there very quickly. And then you can click on all your clinical policies, procedures, and forms, and all your medical directives if you'd like. And it gives you a comprehensive list. So all of these links are embedded. There's lots of documents behind the scenes. So it's very thorough, lots of resources, lots of ideas, lots of great things. We really took our time in developing those things, and it's best opened in Adobe. So you first have to download the document, and once it's saved, you just have to right click on the document and open with Adobe. That's how it works, because a lot of folks were like, oh, it doesn't work, all the links aren't there, but it has to be opened with Adobe for it to function properly. Yeah, so that's a bit about the toolkit. I'm going to go back to my presentation here. Slide. Right. So that was one of the outcomes. So that kind of ended our funding agreement with the Public Health Agency of Canada. But as a collective, we really recognize the importance of this collaboration, and we really wanted to sustain it and to continue the important work that we started. So away we went, and the advisory committee turned into a Northwestern Ontario RAAM steering committee with partners from each site sitting on that committee, along with some other folks, partners within their communities, in the hope of really expanding services in the region and really looking at how we could expand that kind of hub and spoke type model of care into our region that we know is underserviced and very little service in some of our communities. So we invited folks in the surrounding areas, and we just, the goal of this work is really to continue the work that we started with this PHAC project, and to create that hub and spoke type model of care in the region. So the goal of creating a hub and spoke type model, we agreed that the benefits would be that it consistency across operations. So we're all doing the same thing in a similar fashion. We understand that each community has its beautiful ways and unique ways that they operate. And it wasn't about telling folks that you have to do it this way. It's that we're operating in a similar fashion. It would increase efficiencies. So we'd achieve maximum productivity within like minimum wasted efforts and expenses, specifically in the duplication of services, really resulting in a reduced cost of care, and giving us the opportunity to invest savings into other pursuits that complement RAAM. Also enhance quality, so deliver improved outcomes, working with the Center of Excellence, Medify, and really our local community partners to provide quality care. Enhance market coverage so the expansion of service to remote locations to cover the region in that way. And improved agility, really quicker service for clients in need so that they can access RAAM services across the region. So these goals and principles really align with the work and the outcome of the evaluation that was conducted during our Public Health Agency of Canada project, and really reflected the work that we really wanted to do nicely. So like we've learned really nicely to work collaboratively together. We've gotten really good at that. And so some of the examples that I'll share with you, like so these were the outcomes. So I'll start with the streamlining services. So we're right now, we're working on a data collection, evaluation, and research project in partnership with CAMH, and this is regionally with all the 8 sites and the Center of Excellence to standardize data collection across all sites. So we're able to access the same data at the same time at the same place. So we'll really have some evidence as to what is really going on in Northwestern Ontario and related to RAAM services and addiction care. And to support this initiative, we're planning a 2-day design day event to discuss and move forward with the data collection evaluation, and really to do some face-to-face focus planning for the enhancement and expansion of the hub and spoke model into the region. Also, right now we are looking at a shared drive for new documents, policy and procedure, marketing, logos, just so that we can reduce some of the human resources to create new documents. We know that we spend a lot of time and a lot of energy at each site kind of developing the same thing and using up a lot of resources, when we could kind of standardize that and share information so that we're not reinventing the wheel and recreating policies and procedures that already exist. So we're working on a shared drive that our folks across the region can just access if they need to look up a policy or create a new policy. At least they have a template to start with. Also, for promotional material as well, I've opened an account with like 4imprint, and for promotional materials, giveaways for clients, things like that. We know that there's startup costs for every single item that you usually do. And this way, if folks want to like the item and they want to order more, they can just jump on that website and order more without the initial costs, which is hundreds of dollars each time that you create a new product. So sharing that information and just like streamlining those services. We really want to increase community outreach and awareness to reduce stigma. And one of the initiatives that we're working on right now is creating a website for all our 8 RAAM sites. So we have a landing page so folks can come to that, and we will really, our plan is to create some videos and an awareness to reduce that stigma, that it's a welcome environment and a really welcoming place. And the toolkit talks really about how to make our RAAM clinic safe for folks and feel welcome when they come in. So a website that all 8 of our sites can land on. So if somebody's searching for addiction care in Northwestern Ontario, it's just easy to access. If they're close to Dryden, if they're close to Kenora or Long Lac, they know where to call, who to call, when to call. So that's going to really help consistent messaging. Another goal is to enhance virtual care, and I talked a little bit about that. Our Balmoral site, which was our withdrawal management center in Thunder Bay, it doesn't have the capacity to house a RAAM clinic anymore. But we put in a proposal for the digital front door, which is an initiative through the Royal Mental Health and Research that will provide additional virtual care and quicker access to prescribers and counseling services. That we're hoping that will run out of that 3rd official kind of RAAM site that got shut down during the pandemic. So that will help bridge some of the gaps in our region as well. Currently, our physician, Dr. Carfagnini in Thunder Bay, is supporting 2 sites in the region virtually, prescribing, mentoring, and training local medical staff that live in the community. So we're really working together and getting folks trained and comfortable with addiction care and medicine. We are planning to take a regional approach to offer the service of the digital front door, and we're really hopeful that it will fill some of the gaps that our communities are having struggles with human resource gaps and limited service in the geographical reach. Improving access to service, so developing pathways of care across the region. And one of the things that I'm working on right now is just a really simple staff contact list. So if clients are moving from one RAAM clinic to the next, we can contact one another really easily and share information and have a smooth transition. So they're getting their addiction medicine if they're on vacation or traveling from across the province. And really building on a community of practice. Physicians in Northwestern Ontario are meeting monthly right now, and we're going to be moving into developing a community of practice for counselors and peer support folks as well. One of the big things that I'll hand over after to Denise and Ali is really the mobile services and transportation that was identified. And it is our biggest challenge in our region is transportation, because our geography is so vast and spread out. The dream is to have mobile RAM teams that are able to travel to communities with little resources to offer addiction care, like go to them model as an opposed to come to us. And I'll leave that to Denise and Ali to talk about their mobile model of care to reach underserved communities in the Kenora area. So these are our current RAM locations in Northwestern Ontario. I talked about all of them. Sioux Lookout is working on one, and we've got lots of interest for kind of spoke sites. But the challenge, like, although we're kind of functioning in a hub and spoke type model with Thunder Bay kind of being the lead or the hub, the long-term goal is to ensure that all our sites are operating well with the resources they need in order to further expand and branch out to become hubs and further support spoke sites into the region. And we've really had to take a step back and really assess this as we are facing many challenges. And I think as most people are in our region in regards to human resources, we can secure funding for positions, but we're having a lot of difficulty with recruitment and retention. And we do not want to forge ahead and expand until we can confidently say that our staff are secure and stable at each site. So I'm really excited about the work that the advisory committee and the steering committee have done to drive forward the expansion of this model. And it will certainly strengthen addiction care in Northwestern Ontario. But we definitely still have work to do in order to really make sure that our sites are well resourced and supported before we move forward. But where our hope and our dream and our goal is to expand it to those areas that don't have very little service. So I'm just going to stop my share there and pause for a moment. And ask if it's okay to move forward. And I'd like to hand the presentation over to Mobile Outreach and our regional partners in Kenora, that they've done some really innovative work in this area, and we strive to expand this model into the region. So I'd like to welcome Denise and Ali to talk about their work. But before they start, I'm going to show a video that introduces their model of care. Good.
We have a large population of individuals who aren't able to reach out and obtain healthcare, access to ongoing medical care or medical supplies, or knowing who to contact for each issue. It's confusing. So this allows us to bring almost everything in one little package, and whatever we don't have, we're finding it for them. And we're helping them find that for themselves.
We are that link between healthcare and the people who can't reach out to the healthcare providers, because trying to make an appointment over the telephone, and if you haven't got a telephone, then that's a barrier, and we just break down those barriers.
What's unique about our mobile outreach program is that we are a multidisciplinary and multi-agency approach. We have nurses, social workers, emotional wellness workers, doctors, and nurse practitioners all working together to provide services to clients in the community. We are a partnership with the Northwestern Health Unit, Lake of the Woods District Hospital, and WinHack all working together as well.
I think the first thing I do is I try to build a relationship that's based upon non-judgment and just trying to sit down and have a conversation with the person and start where they are.
Just a hello, right? I think a big part of what we do is just connect with people on the street and let them know that someone's out there for them if they need it.
It really isn't a one-size-fits-all type of program. It is truly based on a lot of different facets of the client's life and where they're at with things.
Amanda has helped me get off the streets numerous times when I was in need to get away from my addiction or when my health was severely struggling. She's helped me set up doctor's appointments, get prescriptions, all basic essential needs that I did not know how to provide for myself. She helped facilitate and be the mediator for me to get.
I was going downhill on the street drug that I really got addicted to. One day I made my choice to go into detox.
It takes a lot of courage to come and ask for that help, so I try to make something that's really difficult a little bit easier. We want to get them onto the treatment as quickly as possible because once they're on the treatment, it's easier to deal with the other aspects of recovery.
It kept me working, it kept my family stable. It made me feel, I was proud. I was really proud to be on this program, this makeup program.
Honestly, I just like the staff here to know like how grateful I am for all you guys do for me. Like really, sometimes I come in here grumpy or I come in here withdrawing or hurt or sick or whatever and I'm not in the greatest mood, but at the end of the day, like, God bless your souls for having this facility and doing what you guys do, because without it I'd be dead right now.
Some of the people I've supported and worked with within the last couple months have gone on to employment. A couple of individuals have stuck with their recovery and not using. People have reconnected with their family.
I think having one good day is a success. And if we have one good day where we've helped someone, that's a huge success. Huge.
Scheduled appointments, walk-in based appointments, into clients' homes if needed. There really isn't a barrier to service with our program, and I think that that really speaks to the uniqueness of what we're doing here.
In my opinion, it's really important that we continue doing this work, so not only the Anishinaabe nations, but all people that live in Treaty 3 can get the help that they need to live a good, happy, and healthy life on their terms.